5 News.
Now at 6, it was supposed to be the answer to prayers of the uninsured, but we've learned Obamacare in California promised a lot more than it delivered.
Was it a case of bait and switch? Julie Watts with the story you'll only see on KPIX-5. Julie?
Yeah, we've been reporting for months that many of the newly insured haven't been able to find a doctor who will accept their plans purchased on Covered California. Now, even insurers are telling some they're out of luck, and state regulators haven't issued a single fine for too few doctors or inaccurate lists.
This one once a day.
Between juggling medications,
This one twice a day.
weekly IV treatments, simply managing his chronic Lyme disease contracted while on active duty is exhausting for this former Marine. But even more exhausting, trying to find a doctor who will accept his Anthem Covered California insurance.
I was on the phone with Anthem for 2 hours while they were trying to find me a doctor within 20 miles. Finally, a supervisor came on the phone and said, "Sir, we have to go. We have other people to help," and advised me I need to cancel my plan.
Under state law, insurers must have enough doctors to enable patients to get an appointment within 15 days within 15 miles of their home. Something Kyle says he couldn't do since even Anthem couldn't find a doctor on its own list to accept his policy.
If we determine that a health plan has violated the law, we will take action.
Back in February, state regulators assured us they were reviewing the Covered California plans for what's called network adequacy. The Department of Managed Care declined a follow-up interview, but back then admitted while it wasn't exactly checking the insurer's lists for accuracy, inaccurately listed doctors would be a violation of the law.
If they willfully misrepresent to us or to the consumers of California, both of those would be.
But they have willfully misrepresented to the consumers of California. We know the list they gave to Covered California is wildly inaccurate. So haven't they broken the law? Can't they be held accountable? A colleague in the room said they were looking into it. But 3 months later, DMHC still can't tell us how many, if any, doctors were inaccurately listed on Anthem's network adequacy filings.
I'll log on my computer and show you over 80 within 20 miles.
We found even more inaccuracies than that. And internal agency emails reveal one day after we first questioned the agency about a lack of doctors, several people on the inside began echoing our concern. Members of its advisory board sent emails warning the director of the agency, and the head of the department's complaint unit warned, quote, "I suspect we are going to have a network adequacy issue very soon." But while DMHC is the agency that regulates insurers, it's Covered California that determines which insurers participate in the state program. What is Covered California going to do to prevent this from happening when open enrollment begins again in October?
Well, we are already engaged in some very meaningful dialogue with the insurance plans.
But Dana Howard won't confirm reports that thousands of people have switched insurers due to a lack of doctors.
We have seen some cases. We don't have a count.
If you find a lot of people are switching from one specific plan to another because they can't find a doctor, will that plan be included in the next open enrollment?
That we could not disclose.
He says that would hinder their ability to negotiate with insurers. But Kyle hopes there's one insurer Covered California won't negotiate with.
I would tell them to get rid of Anthem Blue Cross. They need to be taken off.
Now, Anthem sent us a response just 3 minutes before our deadline stating the notes in its customer service system don't reflect Kyle's story. Reps would not elaborate or provide evidence to the contrary, but said Anthem continues to expand its network.
And now, Julie, what is the state going to do? Are they going to fine Anthem for not having enough doctors?
Well, DMHC says it's still investigating, and it actually has issued more than $100,000 in fines against Anthem since open enrollment began, but not a single one was for too few doctors or inaccurate lists, Liz.
Wow, still a lot of work to be done on this. All right, Julie, thank you.
New at 6, this is a big surprise.